Biomimetic dentistry is one of the staples, one of the main things we focus on in my practice. And biomimetic dentistry should be, well, it interrupts the dental cycle. In biomimetic dentistry, we replace the fillings, the old fillings, replace cavities, things like that. But we do it in a way that the strength is restored to the tooth, and long term, that tooth should last decades, probably the rest of people's lives. And we do it in a very conservative way. We leave as much natural, healthy tooth intact as we can. So let's go through a couple of examples of how I would do a biomimetic restoration on a tooth. So this is a typical tooth with a typical filling in it. Ideally, I treat these teeth before any cracks develop, but unfortunately, a lot of times there are little cracks that start to form. A lot of times in these little sharp corners on the sides, or sometimes it even will start to crack straight down like that. So biomimetic dentistry, what I do, we'll remove this whole filling, and if there's a crack, we'll remove some of the crack here and here. And you know, cracks are a whole other topic, but cracking teeth is a really big problem, and any other materials, when they start to crack, the way that material is repaired is the crack is first removed, and then you can go ahead with repairing it. If a piece of metal is cracked, you remove the crack and then you can weld over the top. If a porcelain bathtub is cracked, you remove the crack and then you use adhesives and putties and whatnot to fix that. If you just try to fill over the top of a crack, that crack will continue to propagate, continue to get bigger, even say underneath a crown or something like that. So those cracks are removed, and in order to do that you need a lot of magnification. I use an operating microscope, same ones that like a neurosurgeon or something like that would use in the operating room so that he can see really well. So we'll use a microscope. I can blow it up 20 times if I want, so I can visualize those little cracks and remove them. So we would remove these cracks like that, and then remove any cavities that may have formed under that. Get a nice solid tooth structure underneath of there. And then what we do is we'll fill that in with a nice layer of adhesive. Now this layer of adhesive is very, very strong. When it's done properly, this adhesive is so strong that just a 2 millimeter square piece, 2 millimeters is not very big, 2 millimeter square piece could hold me up, could hold up a 200-pound man. So it's more than adequate to hold this tooth together and to hold the filling in. And then once the adhesive is down, then we go in and replace the filling. Now the white fillings that we use, it goes in as kind of a gel, and then we shine a really bright light on it. And when that light hits it, it forms a solid. So it goes from a gel or a liquid into a solid. And when that happens, it shrinks a little bit. The molecules are packed in more tightly, so the material shrinks. Most material does shrink when it goes from a liquid to a solid, and these are no exception. And so knowing that, we have to go in and we place the filling in just little tiny increments, like so. So that when it shrinks, it's not pulling away from the wall of the tooth, it's not stretching or breaking the bonds. And so a biomimetic filling that's, say, small or medium-sized, we go in and place little tiny increments, like this, till we get to the very top of the tooth. And so those are all little tiny increments like that. And that relieves the stress of the shrinking material and preserves the strength of the bonds. Okay, now this process, one, you have to know how to do it, and I've invested a lot of time away from my practice, a lot of time traveling, a lot of money traveling, and it's not very well known in general dentistry how to do these. And then the second thing that's required is time. This takes a lot of time to do. If we just went and put in a filling really quickly, didn't take the time to remove cracks or to let those bonds mature, and just put in a filling, what'll happen is that'll shrink, and it usually pulls up from this little floor here, because that's where the bonds are the weakest. And then what do you have? You have cold sensitivity, you have sweet sensitivity, and biting sensitivity. In other words, the tooth just hurts. Teeth should not hurt after they've had a filling. They may be sore for a couple of days, particularly the gums may be a little sore for a couple of days, but teeth should not hurt after they've been fixed. Okay, in biomimetic dentistry, they don't hurt because the bonds are nice and tight. That tooth is sealed off against cold, against sweet, and it's also protected from the mechanical wear and tear that happens to a tooth. It's strong mechanically. So that's how we do a smaller filling. But let's say this crack here, let's say it went clear to the edge here, and we found a big crack under this filling. Or let's say this whole chunk of the tooth just fell off. That happens a lot, particularly when you start to be my age or older. Those teeth are finally getting weak enough that little chunks are breaking off of them. So in that case, we have to remove that whole side of the tooth. Let's say that side is just gone. Either I had to remove it because it was cracked, or it just fell off by itself. Well, we still remove any cracks or cavities from the tooth, and then we lay down our layer of adhesive. And then I may rebuild this corner a little bit with the small little increments. But then this whole chunk right here that's missing, we can replace by milling it out using a CAD/CAM machine. We can just mill that out and glue that in so that this is one solid piece right here. That saves a lot of time. It would take a long time to rebuild that tooth little bit by little bit. It can be done, and some people do it that way. That's fine. But I prefer to have this piece milled, and then we can just glue that on. Now, since it's milled out in one solid piece, there's no shrinking that takes place here. It's already shrunk. Okay, it's not going to change dimensions at all. So then we glue that in. No impressions are required, no temporary is required. You don't have to come back for a second visit. This is all done in one visit. And boom, tooth is done. This part that we left intact is healthy. It won't cause irritation to the gums because there's no margin or seam in the tooth down in this area. And down here, this little seam will be smoothed off and trimmed nice and pretty, and it causes very little gingival or irritation to the gums at all. So this is basically a rundown of how we do biomimetic dentistry, and it's the best investment that you can make in your teeth. This should be the last restoration this tooth ever needs if it's taken care of properly and cleaned, and of course barring any trauma like a car wreck or something like that. That tooth under normal wear and tear conditions should last the rest of your life, and it is a great investment in your health.